This fall, Insulin Nation partnered with Joslin Diabetes Center at their 2012 Innovation Summit in Washington, D.C. We spent some time with John Brooks, President and CEO of Joslin, who shared some of his thoughts and vision for Joslin and their quest for a cure. Delegates from the conference stopped by to see us and share some of their thoughts on being part of the solution, Joslin's theme for the conference.
I'm here today with John Brooks, who is the CEO and President of Joslin.
Thank you for the invite. I'm delighted that you're here, and we're delighted that we're putting on this really what we think is going to be demonstrable, very innovative, and very exciting conference. So yeah, we've had a lot of small programs before, but this was the first time we really decided let's put on a big program, because frankly this disease needs a lot of focus, needs a lot of attention, needs a lot of energy, and let's do it here in Washington to really capitalize on the fact that, again, we have a national pandemic. And we wanted to make sure we could get all the thought leaders, government officials, and others to really convene so we can actually do something about it.
I agree. It's like it really gives it clout having it down here in the nation's capital.
Exactly.
Right.
So far, we've already had a number of great speakers. And again, the beauty is we can get, people that are actually in government helping to put programs in place, and they need to hear our ideas. And we also want to hear what are they doing, what's going on with our federal government and across the state, across the country, as we think about, really putting a dent in what clearly is a major disease for the United States and the globe.
This is what we kicked off with the DiabetesMine innovation project in the last years, the idea that all these different stakeholders need to come together and collaborate better, and that even within the industry, and that's what we're focusing on this year at my event, within the industry, we need to, if we can band together, if we can have, standards, if we can have consortiums, if we can have the different companies work together toward a common goal, it's win-win for everyone.
We believe we are part of the solution. We believe that it's the health and productivity of our workforce that gives us a competitive edge. So we want to do everything in our power to make sure that our people are healthy and well and motivated and are not sick and absent from work. So we believe as a purchaser of healthcare services, we've got to be part of the solution. We have to be a catalyst for change. We have to be a voice to say the healthcare delivery system needs to change and change fundamentally. So it's focused more on prevention and trying to get to health outcomes rather than just be a system that all the money goes to the treatment of illness when it's too late.
dLife has been part of the solution for people with diabetes for 8 years now.
Yeah.
And for us, it's really important. We've actually been partnering with Joslin for a number of years.
Yep.
And we know that diabetes is a bigger problem than any one company can solve. So being part of the solution is being part of that ecosystem and really being a partner, most importantly for us, to the consumers and the people with diabetes, but then of course to the providers and the manufacturers and the health plans. It's about helping people live we like to say their diabetes life or their dLife. So for us, it's being sophisticated in how we help them, but also putting them at the center.
Everybody needs to come to the table, and we absolutely want to be part of the solution. The problem is that we have 26 million people living with diabetes. We have 79 million people living with prediabetes. It's a huge problem. There is no one group that's going to solve it. That being said, there are solutions, and we want to be part of that solution. We know what prevents diabetes, so we want to bring our capabilities, our manpower, our hopes to the table with our partners and to begin to execute on some of those solutions.
I don't think with the diversity and complexity of the healthcare system and the amount of players in the healthcare system that there's going to be one big player that does it all. And to some extent, it's telling me that this is more a team sport than it is like an individual sport. Yeah, and we all have the same goal in mind. I mean, we all are, in terms of patient outcomes and overall wellness, we're all shooting for the same thing.
For us, it's really about coming together.
Yeah.
And when you think about childhood obesity or diseases, whatever the case may be, whatever you're working on, for us, we're thinking about physical activity, food, healthcare, early childhood education, schools. There's a lot of different sectors of the country that are working in those areas. You got the private sector, you got NGOs, you have government, you have academia, you've got nonprofits, you got philanthropy. And a big part of our mission is bringing those sectors together, and sometimes they're at odds,
Right.
and trying to have them kind of leave agendas at the door and work on solutions together.
I mean, our strategic plan at Joslin, the first words in it talks about collaborating.
Right.
Because we can't do this alone.
No.
I mean, this is a huge problem. But if we can catalyze it, if we're the ones that kind of create a little bit of a spark, a little bit of an interest, but if we can leverage the expertise that industry has, if we can leverage the expertise of different players, if you will, across the country, we can get insurers, we can get employees, we can get, basically healthcare plans. I mean, it doesn't matter. But if we can galvanize and energize and get everybody thinking about
Right.
how we can work together
Right.
and, make an impact, that's really the way we're going to do it.